This in-service video will provide product setup and use for the Arrow Balloon Wedge-Pressure Catheter. The Arrow Balloon Wedge-Pressure Catheter is indicated for use in sampling blood for oxygen levels and measuring pressure in the right heart, including central venous pressure, right ventricular pressure, pulmonary artery pressure, and pulmonary artery wedge pressure. In the case of anatomical cardiac defects, the catheter may be used in any chamber which can be entered from the right heart. The Arrow Balloon Wedge-Pressure Catheter is also indicated for use in balloon occlusion femoral angiography, BOFA, of the contralateral leg for adult patients. Wedge pressure catheters, single or double lumen, are available from 4 to 8 French and in lengths of 60, 90, and 110 centimeters. To begin use, open the packaging and remove the catheter tray. Taking care to protect the latex balloon, carefully remove the Arrow wedge catheter contents from the tray and place on the sterile field. After the initial wedge pressure has been recorded, the tip of the catheter should be positioned in the central portion of the pulmonary artery as evidenced by a representative pulmonary artery pressure tracing. Observe the pressure monitor frequently for any change from pulmonary artery pressure to pulmonary artery wedge pressure and reposition the catheter tip as necessary. Precaution: if fluoroscopy has not been used during passage of the catheter, an X-ray should be taken to verify proper tip position. Warning: the catheter must not be allowed to drift into wedge position, because occlusion of the vessel can result in segmental pulmonary infarction. When obtaining wedge pressure recordings, inflate the balloon slowly and stop as soon as the pressure monitor shows a change from pulmonary artery pressure to pulmonary artery wedge pressure. Deflate the balloon as soon as the wedge pressure has been recorded. Warning: it is possible for the catheter to migrate with blood flow, causing the tip to assume a position in the smaller branch of the pulmonary artery. If this happens, full inflation of the balloon could cause damage to the vessel. The patency of the pressure lumen must be maintained in order to obtain accurate pressure tracings. Continuous slow infusion of heparinized saline solution or heparinized 5% dextrose solution has been recommended as a measure which reduces clotting. Precaution: damping of the pressure tracing may indicate clot formation at the catheter tip. If possible, aspirate the clot and then flush the catheter. If blood cannot be aspirated from the catheter, do not flush it because it may be in wedge position. Injection of intravenous solution in this case would cause pulmonary extravasation.